The promise for digital health can only be achieved if leaders are involved, if countries take ownership and the partners come in to support, rather than partners taking the leadership. That is one way that we can achieve digital health in Africa.
Recognizing that digital health right now is at this transcendent moment where the agenda is not about making people aware of digital health, but it's about how digital health can achieve our overall health goals, universal health coverage, the sustainable development goals. So making digital health about health is the one way we can achieve all of this promise.
Reflecting on the variety of conversations that we've had today, I think that there are a couple of key messages which actually translate into very tangible action, which is around collaboration, cooperation, and leadership. Collaboration across different functions, both within government and within donors. Collaboration between the public and the private sector, and the leadership is absolutely key from a ministry to lead us to a roadmap and a vision, and from the vision, all else will come.
So the reality is digital era is here, and therefore digital health is imperative. We need to provide the required leadership and coordination. We need to define the roles of each player, the government, the private sector, development partners, and other stakeholders. We need to set goals and strategies that are realistic for the African continent.
So my belief is that we have to create completely new business models that will enable the innovation and the right financial resources to actually come to bear out of Africa. I think the most important part is if we can get the momentum that is created from these new consortiums, I believe we can break through the bureaucracy that actually currently resists today. If we do this, my strong belief is that Africa will become stronger, but only if we become unified.
I think we need to tap into the innovation and inherent knowledge of Africa about what is needed in Africa and bridge that with global resources and infrastructure.
By identifying common technology components that feed into a common architecture that countries would be able to use, this would give you economies of scale to allow for greater efficiency in training, support, and functionality. And with all of those services, you could have greater efficiencies for health service delivery.